Good afternoon, everyone. I see that the mayor has just connected, and I believe his audio is now connected as well. So if everybody's ready to get started, we will go ahead and get this media gaggle started. Mayor, did you want to start this off for us with a few words?
Yeah, I will. Thanks, Patty. Before I answer your questions about the CARE Acts, I want to alert you to a storm system that is developing. There's a potential tropical storm, number 9, that's currently moving west-northwest and is forecast to impact the Leeward Islands on Wednesday. It's forecast to head to the Dominican Republic and northern Haiti on Thursday before approaching the Bahamas and the South Florida over the weekend. Currently, the earliest arrival to South Florida is likely Saturday, according to the National Hurricane Center. There's still uncertainty in the timing of all this, as the track over mountainous terrain of Hispaniola may slow and weaken the system. It is currently forecast to be a tropical storm when it reaches the vicinity of South Florida. The next name on the list is Isaias. We are coordinating our response with state and federal partners. The time for people to get prepared now. You should already have batteries, food, and fill up your jugs of water from the tap. Those things that we ask you to do on June 1st. Now on to the CARES Act funding. Before I answer your questions, I want to mention the programs the county is providing to all residents, whether they live in unincorporated Miami-Dade or any of our 34 cities. The senior meal program, food pantry programs, testing sites, voluntary contact tracing app, and online community empowerment programs. Surge teams throughout Miami-Dade, including the hotspots in the city of Miami and Homestead. Parks ambassadors, including for Miami Beach and all other coastal communities requesting assistance. Small business program, hospitality and employee assistance program, hotel isolation program, housing, rental reduction and full payment, assistance to small cultural groups, assistance to taxi cabs, limousine services impacted by COVID-19, transit programs in cities and the county, money for not-for-profits to continue to provide services, basic needs allocation through the United Way, contact tracing grants to the state for 250 more contact tracers, support to the school system to include contracted nurses for schools, thermometers, contact tracing app, expansion of Wi-Fi countywide, and enforcement countywide. And we have other programs that are being done on a countywide basis also. Also want to remind everybody that the Miami-Dade County is responsible for the over $400 million that we received from the state and the federal government. And so we're not going to be writing a blank check to anybody. The cities can get reimbursed for expenses, eligible expenses that they are incurring. The cities can, and so it's never been in doubt. All they need to do is submit their invoices for those activities that are COVID-19 eligible, and we will be happy to reimburse the cities for those. This money is meant to go to the people of Miami-Dade County. It's not meant to go to the governments of Miami-Dade County. It's meant to go to the people of Miami-Dade County. And so all those programs that I've just stated are being distributed throughout Miami-Dade County to all 2.8 million residents of Miami-Dade County, whether you live in a city or you live in a county. Or there are programs specifically that a city has undertaken that is eligible for COVID-19 testing. We'll be happy to show us your receipts, show us your invoices. We'll make sure that it's eligible for COVID-19 funding from the CARES Act, and we'll be happy to reimburse you. If a city wishes to pursue something else, something that they're not doing right now, they need to talk to us about it and see how much that would cost and whether it's in the budget. And so, this whole thing that somehow this money is supposed to go to cities and governments, that's not the case. The state of Florida received, a multi-billion-dollar allocation from the federal government. They kept 55% and then distributed the other 45% to counties of over 500,000. And the majority of the counties in the state received no funding from the CARES Act. There were only 12 counties that did. We were one of them, and we will be providing services to all the residents of Miami-Dade. There seems to be some confusion that somehow Miami-Dade County only provides services to the unincorporated area. Nothing could be further from the truth. Our county commission is taking this task very, very seriously. We believe that the best way to allocate this money is throughout the entire Miami-Dade County, so every city will get their fair share to the people. The people in the cities will get their fair share through the programs that are being allocated by the county, and also those programs that have been instituted by the particular cities. And so, I understand that there was a news conference today, and people and the cities want some kind of a blank check from Miami-Dade. That's not going to happen. And it won't happen for a simple reason. Miami-Dade County is responsible for this money. Miami-Dade County has to assure that every cent is spent on a COVID-19 eligible activity. And if money is not spent on a COVID-19 eligible activity, then that money has to be reimbursed to the federal government. And who has to reimburse that money? Miami-Dade County, which means all of the residents of Miami-Dade County have to reimburse that money. We also have to make sure that this money is spent by December 30th. And we need to put this money on the street, in the street, helping people, helping programs as quickly as possible. The last thing we want to do is have money in the bank on December 30th that we then have to return to the federal government. But all the money that we use, all the money that's utilized, has to be for eligible, COVID-19 eligible activities. We're on the hook for it. We're responsible for it. And we are good stewards of the people's money, because this is the people's money. It belongs to the people and the residents of Miami-Dade County. And so with that, I'll be happy to take any questions.
Thank you, Mayor. Let's start off this afternoon with NBC6 Willard Shepard.
Okay, Mr. Mayor, good day to you in these trying times. Obviously, there were some heated words about this over the last 24 hours, and now we even have some mayors, including the mayor of the city of Miami, talking about pending litigation over this. I think a lot of residents that see this would certainly want all of you on the same page. Are you willing to move forward? Olive branch, you guys all, and ladies, kiss and make up and move forward about this, because I think that's something that all residents are looking for from all of you at this particular point.
Well, look, before they went and had a news conference, nobody called me and said, let's talk about this. They just want a news conference, and now they're threatening us with a lawsuit. That's not the way I went to negotiating school anyway. But anyway, look, at the end of the day, what I say it stands. Miami-Dade County has never said that we're not going to be reimbursing the cities for COVID-19 eligible expenses. So if the cities would just simply start to give us their invoices for those things that they have done and those things that they are planning to do in their cities that are COVID-19 eligible expenses, and we can start to put this money back, give money to the cities that have spent some of this money. We also want to make sure that the cities are leveraging FEMA dollars, because what we don't want is a FEMA eligible expense to be paid 100% by this fund, this CARES Act. This CARES Act should, for the most part, go back to the people and help them economically, even though we know that it's also there to help governments and our healthcare workers and our hospital systems and our school systems to overcome some of the difficulties that the COVID-19 pandemic has brought on us. And so start giving us your invoices. We'll be happy to start reimbursing you for those things. And so I know Jennifer Moon, who's on the call right now. Jennifer, I know you sent them some kind of a letter to all the managers and then some of the strong mayors of what it is they need to do. Maybe you can chime in and tell Willard exactly what we've asked the cities to do.
Yes, sir. Thank you. This morning, every city received a letter explaining what we intended to do in terms of reviewing eligible expenses, along with a spreadsheet that they can use to complete a listing of what they've already spent and what they intend to spend. On that spreadsheet is a description of all of the eligible expenses and also the link to the Department of Treasury, where they have frequently asked questions regarding the use of CARES Act funding. And we ask that information be provided back to us by Monday, August 3rd, so that we can quickly review and start processing eligible reimbursements. We do need to have a interlocal agreement in place with each of the municipalities, which we are in the process of drafting now and will be sending as soon as it's ready.
Thank you, Deputy Mayor Moon. Okay, the next question will be from Christina Vasquez, Local 10.
Good afternoon. Well, right when you said that, first thing I'd like to raise my hands on is if you can send me, Steve Vasquez at WPLG.com, a copy of that spreadsheet and the email that went out to cities, that'd be great. And Deputy Mayor Moon, I know yesterday during the commission meeting, you were trying to break down for one of the commissioners about the concept of there being different pockets of money. And you used Miami Gardens as a reference point, explaining what portion would be coming from CARES, what portion they could leverage FEMA. And so what I would love is a bit of point of clarification on that. And it was kind of mentioned earlier about this idea of depending on the expense, how they flag that and work with your office. And this idea of some municipalities, especially the smaller ones, being a bit concerned about having a cash flow problem. So if they go into that reimbursement system, perhaps they don't even have enough in the city coffers to kind of float what they need to accommodate for the time delay of submitting a receipt or an invoice to you all to get reimbursed. So I know that's a lot, but as succinctly as you could, trying to help, us sort of break down how that works.
Well, if I can just jump in on the small cities and the issue with reimbursements. Deputy Mayor Moon and I spoke about that this morning, actually. That some smaller cities are going to have problems with the reimbursement issue, and we have to work through that issue. All right, and it's not fair for them because they don't have a big stash of reserves and they have spent a lot of money, and so we want to get money back to them as quickly as possible, knowing that we only give 20%, which may be the requirement for the FEMA match. They may not have the other 80% to front the other 80%. We're going to have to work through that issue, especially with the smaller cities. And so, Jen, you can answer the other question.
Sure. FEMA, when there's a FEMA eligible expense, the local match is usually between 12 and 15%. It depends on the type of expense. And that is what's supposed to come from the local jurisdiction. Specifically in this particular emergency declaration, the federal government has indicated that CARES Act funding can be used as the local match. What typically happens with FEMA eligible expenditures is that cities have to spend the money and they spend money. It's usually after a storm, and for several months after a storm, they're spending money that ultimately will be reimbursed by FEMA, but they have to put the cash out ahead of time before they can get that reimbursement. And that's really difficult for small jurisdictions that have small budgets. Their cash flows are usually just their ad valorem or their property tax revenues and a few other revenues that they get. They don't have large capital programs. They don't really have cash available. In this situation, because we are allowing jurisdictions to be reimbursed for expenses back to the beginning of the emergency, back to the beginning of the pandemic, as soon as we can get those eligible expenditures and the backup information and the interlocal agreements in place, we'll be able to provide the local match reimbursement right away, which will put cash in the hands of the jurisdictions that they can then be using for other expenses. And then, as the mayor said, we want to work with them. We want to look at what the expenditures are that they have and work with them and figure out ways that we can make sure that they have the cash they need to keep their operations going and to implement programs that they may want to implement that are CARES Act eligible programs moving forward. The reason I used Miami Gardens as an example is that's one of the 3 jurisdictions that actually did send us their what they had already spent and what they planned to spend. And they had indicated that they had spent $2.2 million. Well, they won't be reimbursed from CARES Act for that entire $2.2 million because to the extent that's FEMA eligible, the majority of the funding for reimbursement for those expenditures will be from FEMA and don't necessarily need to come from the CARES Act. However, I spoke with the mayor of Miami Gardens today, and there's actually expenditures that they may have incurred that they hadn't already included in what they submitted. And so once we were able to provide the city with the description of what is CARES Act eligible and FEMA eligible, now they realize there are other things they can submit as well. I think that answered all of the questions.
Yeah, I appreciate that. Thank you.
Remember, we want to leverage as much of this money as possible, and whenever we can use CARES Act money to leverage another 90% or 85%. That's what we need to do. So keep as much of the CARES Act money here for the real purpose of the CARES Act, which is help the people of Miami.
Thank you, sir. Next up, Joan Murray, CBS 4 News.
Hello. Can you hear me okay?
Yeah.
And Mr. Mayor, Mayor Suarez had said that the city was offered $30 million. Is that correct? And can you give me examples of, what the city can use it for? He was saying that they're being denied money for firefighters and police officers. And my second question is, you also said that individual residents could be getting this money. So what are some examples of what an individual resident could apply for, and how would they go about that?
We already have, I'll answer the first question first, and which is all the city of Miami has to do is give us the invoices for the COVID-19 related expenses of the police and fire departments. We'll be happy to reimburse them. All you have to do is submit the invoice. Nobody's denied them that at all. Right? And so, there's a lot of hoopla here. A lot of people talking a lot of stuff that they really don't know what they're talking about. And so they really just need to submit that. Any city that has COVID-19 related expense, eligible expense, just submit your invoice and then we'll be happy to reimburse you. Are we going to reimburse you at 100%? Probably not, because if it's FEMA reimbursable, we want to give you the match for the FEMA reimbursement. That way you don't even have money coming out of your pocket. But we certainly want to leverage as much of this money as possible. That's what we're going to be doing. Look, we have for the senior meals program. Jennifer, how much have we allocated for the senior meals program? And
The balance that we have indicated we need for the senior meals program moving forward is about $35 million, but we've actually spent at this point around $80 million. But we know that for what we've spent so far, we will get FEMA reimbursement again for 85% of that. And so what we're really looking at is the match that we have to provide to the FEMA reimbursement, and then the continuation of the senior meals once the deadline for FEMA expense has been reached. Originally, FEMA had indicated, or the federal government had indicated, that FEMA would only reimburse expense through the end of July, but now that date has been extended to October. So that will help put more of the CARES Act funding directly into the communities rather than having to cover for operational type expenditures from local governments.
all right, so now I'll answer the second question, okay? And so you asked me for some examples, and so here's some examples. Residential landlord financial assistance, $10 million. Emergency rental assistance, $10 million. Restaurant workers program, $5 million. Basic needs for United Way will distribute $20 million to the community. Veterans, $20 million. Bulky food purchases, $2 million. Senior meals, $35 million, which we are leveraging a lot more from FEMA. Business and employee assistant, $1 million. Hotel stays, that means we're paying for people to stay at hotels so they can be isolating from their loved ones, their family, $5 million. Small business grant program, $25 million. Restaurant loan program, $30 million. For not-for-profits, $10 million. Taxi and jitney drivers and limousine drivers have suffered a lot, about $10 million. Arts and culture, $10 million. And other industry assistance, $25 million. And then we have another $50 million in reserve for an employment and employment stimulus program that's to be spent. So that's money going directly to the community, directly to businesses, directly to residents, all throughout Miami-Dade County, not just in the unincorporated area, all throughout Miami-Dade County.
Can they just put in an application with the county to access that money? Is that what they need to do?
Yes, we're setting up all these programs. These programs have been, most of those programs that I just outlined for you have been approved by the county commission, and we're setting up the process to get money into the streets as quickly as we can. And again, all the cities have to do for their expenses, just submit your reimbursement form and then tell us what the activity was. If it's COVID-19 eligible, we will be happy to either reimburse it or give you the match that you need when you apply for it.
But individuals go to the county, or do they go to their city to do the application?
Some of them will go through United Way. We've actually given money to the United Way. Some of them will go to FIU. Different programs have different places where you go get this money. Some will be in the county, some will be in different places. And so that's, but it's going directly to the people.
Okay, thank you, Mayor.
Thank you, Mayor. Mayor, real quick, do you want to skip around English and Spanish, or do you want to do everything English first and then move to Spanish?
Oh, let's do English first, and then we'll go Spanish.
Okay, so then we will go now to Miami Herald, Aaron Leibovitz. Aaron, are you here? Okay, Herald Dan Chang, I know he was on here.
Hi, can you hear me?
Yes.
Hi, thanks, Patty. Hi, thank you, Mayor. Mayor, my question is really about contact tracing. It's been 3 weeks since the county and the health department signed an agreement to boost the county's contact tracing workforce, and I'm wondering if it's time to make an assessment yet. Do we have enough contact tracers? Are they doing a good job? What's working and what isn't, and to what extent is the health department cooperating? Because my sense, and speaking to Miami Beach Mayor Gelber, was that the health department is really just kind of reporting back to the governor in Tallahassee, and I'm wondering what could be done about that on the local level too.
I got to get you an update on what their progress is with hiring the additional 250 contact tracers and where that process is at. I can tell you that at this point, with still our positivity rate hovering around 20%, and then the results of exams coming back 5, 6, 7 days later, the work of contact tracing is limited. What we want to do is put them in place so that as we get the contagion level down, when their work will actually mean something more than today, then get them in place. I don't have an update as to how many they have. We on the communication side, Mary Marquez can answer the things that we're doing communications wise to get more of these answers. We also have a dashboard ourselves, a website that you can go to, and then you can start answering these questions. We saw interest initially, and then it's kind of waned a little bit. We got to reinforce that's open. We're looking at an app that will give you an exchange of keys if you're close to somebody who eventually comes up positive. But Daniel, you're absolutely right. The delay in getting the results hampers the work of contact tracing and contact tracers because it's taking 5 to 7 days, and it is difficult for somebody to go back. And by the way, I took a test. Now I'm with somebody. Oh, I happen to be positive. Well, I've been with somebody for 5 days, 7 days, waiting for the test results. What are we doing about it? The last testing site that we opened up in Tropical Park comes with its own laboratory. And so we expect the results on that particular site to come back in 48 hours. Our Deputy Mayor, Maurice Kemp, is working with the state to see if we can up the capacity of the laboratories in this area and throughout the state to get these results back quicker. We desperately need to get these.
All right, thank you, Mayor.
Thank you, Mayor. Greg Allen, NPR.
Let me unmute. Mayor, if I could ask you another unrelated question. I want to ask about the Marlins. Did you get a briefing on that at all? Do you have any information about what's likely to happen with their season, and what impact does that have on the county as you see it?
Well, there's no fans, so it's all TV revenue. So as far as the county's concerned, it has minimal impact on the county. They still owe us the rent, whether they they play or they don't. So financially, there's not much of an impact to the county. I just feel that off the cuff remark is that I think the NBA has got the right formula. They've got to put people in a bubble, keep them in there, and not have interaction with the outside world. If you think that somehow you're going to be playing and then your players are going to go back in the community and you're not going to get COVID-19 on your team, I don't know who's advising you. All right. I know that I think I spoke to the Marlins and said, look, this is the way you got to do it. And the only way that it'll work. And unfortunately, I think that in baseball, they allow their players to go back in the community and then they're going to reflect the community. So I really don't know what's going to happen with the Marlins, but hopefully football will do the same. They got a bigger roster, but the only way until we get some kind of vaccine is to keep them isolated and then test them, and get results right away to keep anybody that may be infected away from the team, because that one person can really start to infect the rest of the team, which apparently that's.
On that issue of rent, I mean, is it possible there could be CARES Act money for something like that?
I don't think so. CARES Act, that would be the Marlins having to be eligible for CARES Act money. We don't have any money to give to the Marlins. We're not going to give any money to the Marlins. They owe us the rent, and we expect to get paid.
Thanks.
Thank you, sir. Up next, Patty Mazzei with the New York Times.
Hey, Mayor. Thanks for doing this. Last week, you had mentioned that people might want to social distance at home and maybe even wear masks, even if they're not sick. I'm wondering if you could talk more about that. What is it that you are seeing that, I mean, okay, there's a lot of transmission in households, but like what more can you tell us? I'm sort of still stuck on that idea and how people that probably don't think that if nobody's sick that they have to be careful within their own households.
Well, the thing is, Patty, that this disease is it's unlike any other disease that we've seen. If you have the flu, you're coughing, you're sneezing, your eyes are watery, you feel really bad, and you know it. And so, hey, that person's coughing, they're sneezing, put on a mask. But in this case, 50% of the people that are walking around with COVID-19 don't even have any symptoms. They don't even know they're sick. That's the problem. And so you're in your house, and when you have such a high level of contagion, when you have such a high level of positivity, then there's a good chance that a member of your house, if you live in, 3, 4, 5 people, somebody there may have COVID-19, not even know about it, and spreading it around. So yeah, my message is try to keep your distance even from your loved ones inside even your own house, and then definitely try to keep your distance and wear masks when they come from outside. And try to curtail your visitation, try to curtail any social activities with your friends or your family. Just because somebody's your cousin doesn't mean they don't have COVID-19. Matter of fact, it doesn't mean that you don't have COVID-19, because you won't even know about it. That's the problem, and that's the issue that we have COVID-19. That's what the message is, that we're seeing a lot of this transmission happening inside the home, inside people that know each other, friends, etc.
Are you seeing that in surveys, or is the health department providing you with a list of clusters of where people are getting sick? I mean, is it that someone gets sick outside at work and then brings it home, or is it that at these family events people are bringing it home? I mean, do we know more? I guess we're still frustrated that we don't know where the worst places of exposure are.
Well, some of the the limited information we get from contact tracers is something like 30-something% get it at the house. Okay, in the home, somebody that was in the home, somebody that they knew. So that's a good rate. When you're everybody's now, when you're outside the home, hopefully we're protecting ourselves better, but inside the home too, we have to be careful now, because the limited information we do have indicates that in home, family settings there's a high rate of infection.
Thank you. Out next to Veronica Zaragovia with WLRN.
Hi, Mayor. Thank you for taking my question. I wanted to ask you if you could share any update on the 400 hotel rooms, how that's going in terms of people requesting those. And also you mentioned nighttime testing, and I just wanted to ask about how soon you think that might happen and around where in the county. And thank you.
Thank you. Deputy Mayor Maurice Kemp is on that. He'll give us an update if he's on the line of where we are with nighttime testing and additional testing in Miami-Dade.
Sure. About the hotel rooms, if those are, if people are calling the number and booking and asking for help to isolate.
Yeah, we're getting more and more people to do that. But what's interesting about it is that half of the people that book don't show up, and so we don't know why, but they don't. But we still have hotel rooms available. But we got more and more people that are taking advantage of that.
And if it's okay, can I ask you also a follow-up, because of I was interested to know how the citation is going now that it's also civilian. Do you have any information on how how that's going with the mask? Sorry, the mask enforcement.
Yeah, we've got over 100 citations given to businesses. We've closed 40 businesses so far in the entire COVID-19 episode, and we have close to 200 people that have been cited for not wearing their masks in a public.
Okay, thank you so much. And if Deputy Mayor Kemp has anything on the nighttime testing, that'd be great. And thanks again.
Will do. We'll try to get you that information.
Veronica, go ahead and send me an email with that request, and I can also get you the exact numbers on the civil citations as well.
Wonderful. Thank you so much.
Okay, WSVN, I know that I see the news desk is logged in. Does anyone from Channel 7 have a question? I saw Andrew earlier, but I don't see him anymore. 7? No? Okay. I think we have one more in English. Elaine Devalle, blogger. Elaine, are you still there?
Is this working? Do you hear me now?
I hear you now.
Hi, Patty. Thank you, Mayor. Thank you, Ms. Moon, for taking questions. I also want a copy of that email that was sent to the cities, Patty, when you get a chance. I have a couple of questions. One is at the beginning of the information, we got a presentation with a bunch of different organizations and programs that I would imagine the mayor was speaking of CARES money, or does that include FEMA money that is also going to some of these programs and organizations? That's the first question. And then I guess the follow up to that is if it's CARES money because you're going to get reimbursed by FEMA later, what happens with that reimbursement? Where does that then go?
You have an expense and you expend it, and then what you do is there is a match. You ask for from FEMA. You say this is an expenditure I had related to COVID-19. It costs $100. FEMA says, okay, you need a $15 to match. So we put from CARES Act, we put $15 to match when we've already expended the money. And so when the money comes back, it goes back into that line item. And that's how it all balances out. So it's an eligible activity and it's reimbursed by the federal government, although they normally don't give you 100% reimbursement. It's either 10 to 15%. If I said something that's not right, Jen?
No, just to build on that, the majority of those allocations for the grant programs, the basic needs services, and the assistance to the industries, that is almost all CARES Act funding. FEMA is reimbursing largely the sort of the operational expenses that governments have had. All governments have purchased a lot of PPE. We've spent a lot of money sanitizing facilities and our assets, like our buses and, all of the different, libraries, all of the different things that people are using. We also expend a lot of money on enforcement, and those are the types of things that are going to be potentially reimbursed by FEMA. But these specific grants to programs, basic needs grants and things like that are actually CARES Act funding that is going to be utilized for those things.
And I would imagine that that's also true for like the small business program and the rent assistance program and stuff like that doesn't already exist, right?
That's correct, yes.
Okay. But for the meals program, for example, you said that you've already spent $80 million of that. Is any of that reimbursable from FEMA? I would imagine it is. In other emergencies, it has been.
Yes, ma'am. The senior meals is an example of something that is a FEMA eligible activity.
So when you do get that reimbursement back on that $80 million, for example, where does that go?
Well, we have spent $80 million. It is not CARES Act funding that we've spent. We've actually spent county funding. We've put out $80 million related to senior meals at this point. And so it would reimburse the funds that have been utilized for that.
From wherever they came, I guess. Because, for example, also you mentioned the PPE. If, for example, transit, spent money on PPE from their department, would the money be allocated, I guess, to each department equally for the amount of spending that they've had for COVID-19 related or eligible expenses?
Yeah, yes, we have a pretty sophisticated system that we've put in place that is keeping track of all of the expenditures in each department. It keeps track of those expenditures that are potentially FEMA reimbursable, and then those expenditures that would require CARES Act funding. So we have a accounting of that we look at often to make sure that we are keeping up with, making sure that all of the money is allocated in the right places. So essentially, the county is advancing all of this expense. To date, we've spent almost $200 million. So essentially, we're advancing $200 million for all of this expense that we will get reimbursed from FEMA and then from the CARES Act funding.
Thank you so much. Okay, and I forgot, I had one more in English. I almost forgot, believe it or not, about Andy Slater. But I knew he had a sports question and that it wasn't CARES Act related, so I was waiting.
Yeah, it's not about money, Mayor. It's about the Marlins. So there's a lot of protocols in place for just any person coming from out of state into Miami-Dade County, whether it's by car or by plane. The Marlins have positive cases, and there's known exposure, obviously, from everybody on the team. So when they do eventually come back to South Florida, which I presume will be sometime soon, is every player on that team, the staff included, are they going to have to 14-day quarantine, especially since the fact that they have been exposed to the virus knowingly?
Great question. I would say that unless the governor gives a exemption, which he may have for professional sports, that the rules would apply to them.
I know the exception was given for professional sports, but obviously this would be a different circumstance because they would be coming into Miami-Dade and possibly playing in Miami-Dade, and it's been known exposure. So is there something that you would have to say about that, or it would only be up to Governor DeSantis?
Those folks that, they should follow the protocol, the medical protocol. If somebody's been exposed, just like any other person, they need to be tested and self-quarantine for a while. That's the normal protocol. That's what we would ask them to do. By law, if you come from certain states and certain areas, hotspots, you're supposed to be quarantined for 14 days. There is no law that says that you have to self-quarantine, self-isolate, and all that, but unless you come from these hotspots. So I would assume that they would follow the protocol, the medical protocols, and I would assume they also follow law unless they have some kind of.
Thank you, Mayor. Okay, our first question in Spanish comes from María Fernanda López, Noticias 23. Más adelante.
Gracias. ¿Me escuchan?
Sí.
Perfecto. Bueno, son varias preguntas. ¿Las digo todas de una o voy una por una?
Una por una.
Bueno, primero que todo, alcalde, buenas tardes. ¿Cómo los residentes se verán directamente beneficiados entonces con el CARES Act?
Bueno, ya lo expliqué en inglés. Mira, la comisión ya ha aprobado $10 millones para un programa para the landlords, okay. Hay para también ayudar con renta $10 millones, para ayudar con los trabajadores, los empleados del restaurante $5 millones, para necesidades básicas $20 millones, para los veteranos $20 millones, para las comidas de las personas de tercera edad $35 millones, para pequeños empresas, pequeños negocios $25 millones, para los restaurantes un programa de préstamos, pero préstamos de verdad que son forgivable, es $30 millones, para lo que las organizaciones non-for-profits $10 millones, para los taxis, lo que están manejando taxis y limousines, otros $10 millones, y también para cultura $10 millones, y otra asistencia de industria $25 millones. Así que todo eso va directamente al pueblo, todo eso va directamente a los dueños de negocios y también empleados de negocios, y también ayuda para personas que necesitan ayuda con pagar su renta, todo tipo de ayuda directamente al pueblo, ya sea aprobado por la Comisión del Condado de Miami-Dade, utilizando esto.
Bueno, ¿qué le responde usted, señor alcalde, al alcalde Suárez, que hoy en conferencia de prensa dijo que estaría viendo la forma de tomar acción legal para demandar al condado porque se siente que le han retirado o que no le están permitiendo tener acceso al dinero para sus residentes?
Primero es falso, porque él dijo que nosotros no íbamos a pagar por la policía, los bomberos, etcétera. Es completamente falso. Simplemente tiene que someter sus recibos, su demanda y si es una actividad que es elegible para pagar con este dinero, el condado se lo va a pagar. Así a todas las ciudades. Así que de verdad no sé de dónde sacó esa información, está mal informado. Y también si quiere poner una demanda, que pueda poner la demanda, porque aquí tenemos 10,000 demandas en el condado de Miami-Dade. Yo no tengo ninguna preocupación de esa demanda. El dinero vino al condado de Miami-Dade para todos los residentes del condado de Miami-Dade. El gobierno del condado de Miami-Dade es responsable por ese dinero y que se va a distribuir para todos los residentes de este condado. No es para los gobiernos del condado de Miami-Dade, es para el pueblo del condado de Miami-Dade. Y como hemos demostrado, la mayoría de este dinero va a llegar a los residentes del condado.
Quisiera que explicara un poquito más eso de que usted estaba diciendo en inglés, que todos los residentes del condado de una manera u otra, sin importar la ciudad en la que vivan, pueden beneficiarse.
Todo ese dinero que yo hablé hace poco, 10 millones de 25, todo eso son los residentes del condado de Miami-Dade. Quiere decir, tú vives en una ciudad adentro del condado de Miami-Dade, eres un residente del condado de Miami-Dade. Pero si tú vives en una ciudad, no es necesariamente que tú vivas en otras partes del condado. Así que todas las personas que viven adentro del condado de Miami-Dade, incluyendo 2.8 millones, que incluye 1.6 que viven en municipios, ciudades, van a recibir el dinero que vino del Estado y también del gobierno federal en una manera que está distribuido distributed por la Comisión del Condado de Miami-Dade, pero también los municipios que han tenido gastos que son elegibles para pagar con este dinero. También lo que tienen que hacer es emitir sus recibos y nosotros lo vamos a pagar. Lo que los residentes tienen que entender, el condado de Miami-Dade es responsable por este dinero. El condado de Miami-Dade no le va a dar un cheque blanco a ninguna otra ciudad, porque al final es el condado de Miami-Dade que es responsable por ese dinero. Y si alguien malgasta ese dinero, es el condado de Miami-Dade que tiene que pagarse ese dinero al gobierno federal. Así que por eso es que simplemente mándanos los recibos y nosotros, si es elegible, nosotros le vamos a pagar a las ciudades los gastos que han tenido en combatir el.
Gracias, alcalde. Ahora pasamos con Adriana Delgado de Telemundo 51.
Hola, buenas tardes, alcalde. Pati.
Hola.
Quería preguntarle, alcalde, en referencia a lo que dijo el alcalde Suárez. Él dice que del dinero del CARE Act le tocaría a la ciudad $81 millones por la población que hay aquí en Miami. ¿Por qué él dice que son 81 y ahora les va a tocar a todas las ciudades 30 millones?
Le toca,
¿Por qué no
le toca $81 millones. Si todo el mundo recibe exactamente la misma cantidad en todo el condado de Miami-Dade, le toca a los residentes del condado de Miami-Dade, los residentes de la ciudad de Miami, ¿okay? $81 millones. Pero lo que no le toca, $81 millones al gobierno de la ciudad de Miami. Son los residentes de la ciudad de Miami, son los negocios de la ciudad de Miami. Y todo ese dinero que yo he dicho se va a distribuir a todas las partes del condado de Miami-Dade, a todos los residentes del condado de Miami-Dade, incluyendo todos los residentes de la ciudad de Miami. Así que él está equivocado que esto va a un gobierno. Nada más que hay un gobierno que recibe estos fondos. Es el gobierno del condado de Miami-Dade. El condado de Miami-Dade entonces tiene el deber para proteger ese dinero para que vaya lo más posible a los residentes y los negocios del condado de Miami-Dade. Si hay algunos municipios, y muchos de ellos sí lo tienen, que tienen gastos, han tenido gastos combatiendo el COVID-19, lo pueden demostrar que es elegible para que nosotros podamos pagar por esas medidas, lo vamos a hacer. Pero el $81 millones no va al gobierno de la ciudad de Miami, va a los residentes de la ciudad de Miami. Y eso es lo que vamos a a tratar de hacer lo más posible, lo más, en inglés se llama the most equitable way possible para todos los residentes.
Perfecto.
Gracias. Ahora paso con Jacqueline Dos Ramos del Canal 8. Jacqueline, ¿estás ahí? I know she was about to go on the air, so she may have skipped out. Okay, I think that will do it. Mayor and Deputy Mayor, thank you very much. And thank you to everyone for being here. Mayor, any final things that you want to say? I know that as the day has gone on, there's been a little bit more interest in that, the cone of uncertainty, as we call it. Any final thoughts on people looking at the cone and starting to get worried about it?
Well, we should all be prepared. Like June 1st was, we gave out the message about the hurricane. Yes, we're in the middle of a pandemic, but yes, a hurricane could be coming. We're not saying it is, but we should all be prepared. Get at least 3 days of food and water. Make sure your generators, if you have some, are working. Make sure that if you ever start your generator, it's outdoors. Make sure to get batteries for your radios, and make sure that if you're in an evacuation zone, that you know where you're going to go. Now, prepare now. Don't try to prepare the day of. We have over 80 shelters that will be open if depending on the strength of the storm. And we have made arrangements for social distancing in our shelters. We have the capacity for about 100,000 people in our shelters. And so we are keeping an eye on the storm. Everybody just keep an eye on it. Again, it's slated to be, when it's in our vicinity, some kind of a tropical storm. Hopefully it'll be less. Maybe it will be dissipated by the mountains of Hispaniola and it will slow down. So just keep an eye on it, but get prepared. That's, we live in South Florida. We live here in Miami-Dade. We go through this every year. Be prepared, make your preparations, know where you're going to go, and then keep an eye on the storm. And then, again, the final word is, again, on the pandemic, put your mask on, keep your mask on, keep your social distance, wash your hands, and even in the home, try to kind of, keep your distance a little bit, at least for the next month or so, until we see the trends, continue to go down. Hopefully, we see the trends stabilizing and heading down a little bit. Hopefully, we can continue to do that and get back to normal and get back to the new.
Okay, we're good.
Maria Fernanda is raising her hand.
Oh, hey. Mape, that's Noticias 23.
Gracias, alcalde. Una pregunta para una de mis colegas que está haciendo esta historia para el día de hoy sobre el propósito de los Community Empowerment Programs. ¿Qué tipo de preguntas se le hacen a las personas en la encuesta y cómo estas respuestas ayudan al condado a combatir la pandemia?
¿Cómo se llama el programa?
El programa del Community Empowerment Program, el que tienen que llenar la encuesta sobre si fueron positivos o negativos, como para el tracking.
Ok, lo que está sucediendo con ese programa. ¿Y qué más?
¿Qué tipo de preguntas se hacen en la encuesta y cómo estas respuestas ayudan al condado a combatir la pandemia?
No sé si el señor está aquí que está en cargo del website, pero las preguntas nos va a ayudar a nosotros para ver si hay ciertos hotspots que están contribuyendo para el contagio aquí en el condado de Miami-Dade. Eso es un aumento a lo que es los contact tracers del Departamento de Salud. Deseamos más y más personas que entren en el website. Danos la información para que eso pueda aumentar la información que tiene los contact tracers, pero también de una manera más fácil, porque es mucho más fácil que la persona lo pueda hacer online, que alguien que te tenga que llamar y empezar a preguntarte dónde estuviste, etcétera. Así que esto es un proceso un poquitico más fácil en la computadora y le pedimos a todas las personas que han salido positivos que por favor utilicen ese sitio.
Okay, thank you, Mayor.
Thank you, everybody. Have a great afternoon.
You too, thank you.